This is the practical demonstration for practical 1 GIT module. The first image that you need to look into is acute appendicitis. As shown in this image, this is actually the whole appendix, and apparently this appendix appears enlarged. Okay, and most importantly, it is also thickened and enlarged. And you would like to see presence of erythematous or congested surface. So basically, if it's blackish or reddish, this is actually the area of erythematous and congested area, and this yellowish material is basically the pus at the serosa. Next, we are looking into ulcerative colitis. So this is actually an inflammatory bowel disease that involves the whole length of the colon, right? And basically, it causes the whole colon surface to become erythematous. It's red, and you can actually see that this is a normal haustral fold, and there's actually reduced haustral fold at this area. And you can actually see ulcer, but the ulcer is basically very shallow ulcer, and because of that you can see there's a lots of beads like surface. This is what we call as pseudo polyps. Okay, next we are looking into Crohn's disease. So basically this is actually the disease that can occur at any part of the GIT, not exclusively in the colon, but this is actually showing the the colon. Most important features is you can actually see is that it actually skips certain areas. So this area of the colon is involved, and this is not. Okay, and then what is another features is actually you can see this surface of the mucosa becomes what we call as pseudo polyps or cobblestone appearance, and basically you can actually see this is actually the the whole thickness of the bowel, and it is involved the whole mucosa. Okay, so the whole part of the mucosa until the serosa is inflamed. Over here you can also see there's actually inflammation down to the mucosa, and this is the one what we call as deep fissural ulcers. Okay, so this is a deep fissural ulcers, and most importantly, because of the inflammation, it causes the whole wall to become thickened and fibrotic. Okay, and most importantly, the fat that you can see usually in the whole surface of the colon, it become creeping in between the in the serosal surface because of the inflammation. Some of it is lost, so these are the creeping fats. Okay, next is we are looking into acute pancreatitis. First of all, this is a pancreas, and obviously because of its, if it's inflamed, it become enlarged or swollen, and most importantly because of the destruction of the blood vessels, there's hemorrhage there and there, and most importantly you can see the yellowish calcification on the surface. This is actually characteristic of acute pancreatitis. So this calcification is actually calcified soap. Next, you are looking into chronic pancreatitis. So this is actually the pancreas. This is the lumen of the small bowel. So obviously this is actually a pancreas that has gone into chronic inflammation. Most importantly, you can see that the pancreas is actually shrunken, and you can actually see that there is actually areas of fibrosis. All right, and another features that you can see, there's actually a pseudocyst inside there. Okay, so these are the features for chronic pancreatitis. Next, for pancreatic ductal adenocarcinoma or pancreatic carcinoma, Most importantly, you can actually see this is a spleen, this is actually the duodenum, alright, and the features, this is the tumor, alright, this whole thing is a tumor, has the features of malignant tumor. It is actually not well circumscribed, poorly defined margin, and you can actually see that the cut surface is heterogeneous with areas of hemorrhage and necrosis. Okay, and next one is we are looking into gastritis. So this is actually the surface of the gastric or stomach mucosa, and the normal color usually this color, but you can see there's patches or areas of hemorrhagic or erythematous areas, and this is what we call as erythematous areas of in the stomach. It is due to pancreatitis, most commonly acute pancreatitis. The next one is peptic ulcer disease. So you can see this actually a stomach mucosa that has been opened up, and most importantly you can actually see that this area become erythematous, right? And obviously you can see an ulcer there, and what important in this ulcer, it is actually well demarcated, right? And surrounding the areas of the ulcer you can actually see there's actually loss of rugae, and inside the ulcer the base is basically hemorrhagic. Okay, next we are going to look into the virtual microscopy. The first slide that you need to look into is on acute appendicitis. So when you open the link, you click the link, this page will appear. Click on this button to maximize the view, and when you have the view, please zoom into this area so that you can actually see this serosal and mucosal area, right? And from the mucosa until the serosa you can see transmural inflammations. Basically there's inflammation of neutrophils in the whole thickness of the appendix wall up to the serosa, and basically you can actually see there's actually edematous stroma, right, as well as destruction of the mucosa. The second slide that you need to look into is a slide on ulcerative colitis. So when you open this virtual slide link, you can actually see this slide has its own annotations which will help you. Please read into it. But from the low power itself, you can actually see that there's actually ulceration in the mucosa, and this is what we call as broad-based ulceration, a features of ulcerative colitis. And importantly, because this is an inflammatory disease, so you can actually see there's actually a lot of inflammation in the stroma, okay, mainly composed of lymphocytes, and it causes the crypts to become distorted. Okay, usually the crypts are actually big and large and has spaces there, but that is actually quite distorted. It becomes small and shape is actually very irregular, and you can actually see there's actually a crypts here, okay, also distorted, but most importantly inside there there's a lot of inflammatory cells, okay, and this is what we call as crypts abscess. Okay, next is a slide on Crohn's disease. So when you open the link, it will open here, but from this low power itself you can actually see here this thing. This is similar as before, an ulceration, but the ulceration is actually deep into the muscularis layer. Okay, so this is actually a deep fissural ulcer, and most importantly you can actually see from the ulcer up to the serosa there's a lot of inflammation, mainly chronic inflammatory cells. And the most important thing that you can see here is actually there's actually collection of histiocytes, and some of the cells has multiple nuclei. So these are actually the granuloma and the multinucleated giant cells. Next is on acute pancreatitis. So when you open this slide, it's a bit different. It has a small picture, but please click on this image, alright, this button to maximize the image So when it is maximized, you can actually see there's actually pancreas tissue here, normal pancreas tissue, but up there the whole pancreas tissue is basically lost. So this is actually necrosis of the pancreas with areas of hemorrhage. So those are the pictures of acute pancreatitis, and this loss of pancreatic tissue is basically due to autolytic digestion of the pancreatic tissue. The next one is chronic pancreatitis. So you can actually see there's actually pancreatic cells, tissues of islets here, and over here you can see the islets become smaller, and when you look into high power, you can actually see the areas of fibrosis, and most importantly, the cells infiltrating the tissue is basically lymphocytes or chronic inflammation cells. So that's the reason it is called chronic pancreatitis. The next one is on pancreatic adenocarcinoma. So when you open the slide, you will it will open like this, and please click on this button again to maximize the view. And basically when you look into the slides, you know already this is actually malignant, because you can see very irregular glands. Okay, this is what we call as malignant glands, and you can actually see all the features, the cellular features of that shows pleomorphism, hyperchromatism, high NC ratio, and all sorts. Okay. Next is slides of gastritis. So when you open the image, you basically can see the stomach mucosa. Okay, so this is the stomach mucosa. This is the stomach glands. So most importantly, because this is a gastritis, so you can actually see inflammatory cells in the stroma. Okay, so in between the glands. So this is actually features of gastritis. The next one is on peptic ulcer or gastric ulcer. So when you open this image, click this image to maximize it, but from the low power itself, you can see already there's actually discontinuation. So there's a mucosa here, does not have mucosa here, and there's a mucosa there. So basically discontinuation of the gastric mucosa, and most importantly, the cells that you predominantly see there is actually lymphocytes. Okay, that's all. Thank you.